I don't think we can guarantee bias-free, but let's not pretend that either. The other concern I have is that we do have to give people a choice, as Emmanuel said, and the EHDS, the European Health Data Space, does require member states to introduce an opt-out option so that people can choose not to share their data. The challenge with that, and the challenge as we globalize learning like machine learning outcomes, is democratization of the data. If we have an opt-out from selected population subgroups who feel vulnerable, for example, a minority ethnic community or sexual preference community within a country, we actually amplify the bias in our data. But also, as we translate from one place to another, do we believe that an algorithm developed in, a center in London is capable of being dropped into Dubai, being dropped into Nairobi, and is going to function equally well in those populations with their health systems and their different treatment profiles and so on? I don't think we can guarantee bias-free, but let's not pretend that either. But transparency and a standardized method of assessing for things like bias and representativeness, inclusiveness, sharing that data with adopters so they know where they stand, with decision makers like HTA bodies that need to know, do I license it for my health system or not? But actually perhaps also reflecting bias profiles, maybe in an aggregated way, back to populations and say, hey, when we look at the data sets that we are building up at the multi-million level, we see biases, we see missing people in our data. Some of you out there, you're opting out, and maybe we need to help you to feel more confident about opting in. But if you opt out, you're the systems that are developed, the AI that's developed, the drugs and the vaccines might not work so well for you because your data wasn't part of how we developed it. And I think having a more transparent dialogue, not only with AI adopters and decision makers, but with the public is really important.